Welcome to the Future Generations podcast, providing you with the world-changing content necessary to inspire you, your family, and our planet to a life of optimal health potential. We'll help you make the choices that powerfully influence the lives you bring into this world. It's time to strengthen our resolve to do better now and for our future generations with your host, Dr. Stanton Hom.
Okay, welcome to another episode of the Future Generations podcast. This episode and this interviewee needs no introduction. Dr. Larry Palevsky is easily top one or two listens on our podcast, on probably a multitude of podcasts, because you are, I don't know if there's a rating out there, a rating system about the most important pediatrician alive, but that might be you today. And so I just wanted to welcome you back to the Future Generations podcast, Larry.
Oh, great to be here, Dr. Stanton. Thank you for having me back. That was a kind thing to say. I will say that I know nothing of what you just said. I have no context for it. So I'm glad you said it. It's nice to hear it, but I have no idea that it is.
I'll say it this way. Like, we've been in this movement, right? We've been in this movement for a long time. You've been in it longer than I have, and you've been devoted to this health freedom thing. You're wearing the shirt, and I love you for it. And still, like, the number one conversation or question that I get in my practice, or if somebody sees me at an event or something, is, do you know any good pediatricians? And I usually ask like a question back. I usually say, well, why do you think you need one? And not any shot against you, of course, because I'd send everybody to you if you're right by us. But most parents are like, whoa, I don't know. I don't know. I was like, I just thought we were supposed to have one. I thought we had to have one. I was like, who said you had to have one? Like, who do you think believes that you have to have one? And if you don't have one, what do you think? It's just very interesting that parents have this kind of inherent installed belief that, well, you got to have a pediatrician.
Well, I actually want to address that, if you don't mind.
Yeah.
There used to be a time when parents went to the pediatrician and really felt heard,
Yes,
seen, cared for, listened to, and time was spent. And parents walked out feeling like the pediatrician really knew who their children were and really listened, and pediatricians were present. And so there's nothing more precious than a child, an infant, a toddler, preschool, school-age kid, adolescent. There's nothing more precious to a parent than that health relationship, that dynamic. And so, a parent could know that their child is doing well, but they really like it when the pediatrician puts the rubber stamp on it and says, little Johnny's doing great, you're doing great. And, there are things that parents want help with. They want help with feeding. They want help with sleep. They want help with teething. They want help with development. They want help with, parenting. They want help with school issues and psychological issues. And they want, an expert, so to speak, someone who should be trained, all of that. And over the years, with the buying out of practices, with the use of electronic medical records, with the increase in number of shots to be given, and with the increasing number of children with chronic illnesses, along with insurance companies that were, holding X of pediatricians to produce, spend less time, and get product out of these parents. Parents started to feel like they weren't being cared for properly. And, in fact, they barely had time with the pediatrician, or they never saw their pediatrician because it was the nurse or the nurse practitioner, or, a question would would not, just do what you think is best. And so I think that Western medicine is no longer being practiced, because pediatrics is really about understanding development, understanding brain development, being able to help parents through the psychology of different stages of life. And it's about really, caring for this precious growth that's coming into the world. And we've lost that practice of Western medicine. It's no longer present in the office, and parents are looking for it. And so I would say to those parents, because, I've heard a lot, why go to the pediatrician if all your pediatrician is going to do is inject, 79 doses of who knows how many shots, and then not want to talk to you if you choose to delay or not give it at all. Well, yeah, you're right. Why go to the pediatrician? But we've lost practicing Western medicine. And that's why people like you, who, I respect and I understand why you would say, and others would say, why even go to a pediatrician?
It's not even because I will then tell them that we took our kids to a pediatrician, right? There's a doc a couple miles south of us right now. Totally reasonable. He's since I started to send so many people to him, he's very adamant. He's pro-vaccine. And I'm like, okay, great. But he's very reasonable. They're like impetigo for my first, like it was crazy. And we were doing everything we could naturally. And I was like, ooh, I think we're turning a corner. And then at the same time, my wife was like, we should go in. So we went in. And it was this really amazing conversation because he goes, I would do antibiotics. And I was like, what would Rady Children's Hospital do? He's like, oh, they would have, you'd already they'd have a line in her. She'd probably have an immediate reaction to it. And so he gave me the contrast of what his version of the art of Western medicine was versus what they might do. And then I said, if we do them, when's she going to get better? It was a Friday. And he goes, probably Monday morning. I said, you know what? I think she's going to be better by Saturday night by what we're doing. And he goes, then don't do them. I was like, great. But I'm going to take the script and I'm just, thank you for that. If things go for the worse, I at least know what's reasonable. If I need to go outside of what I think is our usual comfort zone and our values for our family, because we trust, we definitely do trust people that are reasonable about certain things. And then we went with my son as well for different issues. But it was interesting because when I asked that question, it's not to denigrate pediatricians. It's just to say, what do you think is the real motivation for it? And when I say, what is a good pediatrician? And they usually just say, one that won't force shots and stuff. And I'm like, okay, but there's a whole other avenue of what good means, right? Mm-hmm. And it's exactly what you said. And I really appreciate you highlighting that, because I would say that if conventional pediatricians still practice the art of Western medicine in the way that it's supposed to be, in a real human focused, patient-centered perspective, child-centered perspective, not an insurance, not an reimbursement, not a pharma-centered perspective, I might be more inclined to go see them too, So I appreciate that contrast. It's awesome.
Yeah. Thank you for that. I see pediatrics as being present, providing time. Don't get me wrong. There are times where, a parent asks a question and maybe I'll respond differently than I would if I wasn't rushed, or if I was not in a bad mood that moment, or, if I had already had enough, or, but, for the most part, my feeling is that the dumbest question is the one that's not asked. And so I want those questions, and I want parents to feel empowered enough where they stay out of my office. The problem I see is that everything in Western medicine has become fear-based. Mm-hmm. And so if the child becomes sick, even the most holistic parents forget what they know about the body's the potential to heal. And they go right down that rabbit hole of, I have to suppress the symptoms. I need the antibiotic. What if? What if? What if? You know, I just took care of a girl who was wheezing and having a little bit of respiratory distress. And I asked the mom to send me a video. And she did. And I said, okay, now send me a picture of all the supplements you have at home. And she did. And I gave her advice on what to do. And the kid slept through the night. And this morning was better. Mm-hmm. And so, you know, here's an opportunity to not get afraid, to not panic. You know, most pediatricians would see what this kid looked like on video and say, you need to go to the emergency room. But, you know, there was room enough for me to work with them. And because, you know, I have 9 years of ER and pediatric ICU and neonatal ICU experience. And that's really what a parent wants to know. Is my kid going to die?
Yeah.
Right. And, but because of the way medicine has been pushed in the last 20 to 30 years, even the most holistic minded parent sees the kid sick and thinks, if I don't get medicine, my kid's going to die. And that's because we have not utilized the real teachings of Western medicine, which is that most kids are not sick with an infection when they have symptoms. They're sick with a resolution of dis-ease in their body. So the purpose of the body, you know, you'll hear people say, well, my kid got sick because his immune system was weak. And I'll say, actually, it's the other way around. Your kid got sick because his immune system is strong. His immune system is capable of taking the dis-ease in his body that has pushed past threshold, again, chiropractic language, and allowed the body to get so overwhelmed with stress that inflammation compromised the body's ability to work. And so because the body isn't going to die until it's ready to die, it has to get sick to save itself from being stressed and pushing past threshold. And so Western medicine doesn't include the understanding that when a child is sick, it's rarely an infection. And that's a 180. That's how far we've gone away from practicing true art and science of Western medicine. And so we have some work to do to solve this dilemma so that pediatricians are not going to bully parents into treatments. I mean, we have parents all over the country who will not go to the hospital when their kid's sick, and they'll even do an unassisted home birth because they don't want the nastiness and the medicalization of their situation. And they don't want to be bullied. And so that's why people would say, well, why go to the pediatrician at all?
It's crazy because fear is, I appreciate you covering the whole concept of like even the likelihood of infection, right? Because the fear of infectious illness, obviously we've been like tsunami waved through that over the last 3 years. And I had a conversation with a parent, with a mother in my practice. I don't want to give too much information about the particular case, but the theme is really important. And I want your take on it. I just fired off a video right before because I was, as I was waiting for you to come on, and I was just like, I'm going to ask you, right? I'm going to ask you this question because fear is, I've found in the way that I've studied that people generally fear three things, like we're trained, we're maybe it's a psychological operation for us to fear this about our health. Germs, obviously, right? Genes, and generally just therefore luck, right? You're just part of the lucky sperm club, right? Or you're not, right? And so this family has a particularly unique exposure to certain things, certain environmental stressors, and they all just have this chronicity of symptoms. And they go through these evaluations with the kids, and one of them, basically the doctor said, well, we're going to check for this one gene. We're going to check for this one gene because if he has it, he's only going to live 10 years. And you're like, the forwardness, the certainty, but then the installed fear was absolutely astonishing, because this mom is, like you said, a powerhouse mom, right? Knows virtually all aspects of every aspect of each kid, understands the environmental stressors, has gone through the ringer of just deciphering what those things and how they cause what chronic issue in their lives. And then it was just this one word that just, right? It just sucked the wind out of her sails. And I'm curious. I have a lot of perspectives that I shared on that video, but I'd love to know what your perspective is like from that lens.
Well, the challenge is that everything in Western medicine is thought to be genetic, even down to autism is genetic.
Of course it is. Right?
Cancer is genetic, right? And, I'm happy to talk to anybody about that subject because, first of all, that's information from the dark ages, because science has actually shown that cancer is not genetic, it's a metabolic disorder, and that genes don't run the way the body works. Genes are affected by the environment. And so we are a dynamic creature in that, we are responsive to the light, the dark, the cold, the hot, the day, the night, the things we put in our mouth, the things we put in our nose, the things we put in our eyes, ears, that we put on our skin, that we inject into the body, the frequencies that come to us, the ancestral information that's moving through us, the stuff that we were exposed to in utero, the things that are in our subconscious levels, the things that are in our conscious levels, all of which are creating a storm or not in any given day based on who we are, what we're doing, what we're exposed to, what we're thinking, what's coming at us, what we're dealing with, etc. So the genes are constantly being turned on, turned off in response to our ancestry, our in utero, and our current day life. And so it's a dynamic process that's always happening. And so we've lost the science because of this agenda that wants us to believe that everything that happens to us is through genes. But again, genes are dynamic. And in fact, the irony of this is that if we had 100 genes, if we had 100 pieces of genetic material in our chromosomes, only 1.5 of the 100 is actually the gene material that makes up our body. So 98.5% of our genetic material is non-genetic material that codes for the physical body. So there's so much more here. And somehow that information gets lost in the translation. And so the 1.5% is what rules the whole body. And that's just not true. Then the germ piece. Talk about information from the dark ages. The whole idea that germs cause disease is actually incomplete story. I won't say it's true. I won't say it's false, but I'll say it's an incomplete story.
I love that.
And the reason it's incomplete is because the mere exposure to germs is insufficient to cause disease. And so all you have to do is take an infant that's coming down the vaginal canal, getting exposed to this whopping dose of vaginal fluid and microorganisms, and then comes out into the world and breathes in upwards of 100 trillion microorganisms, and nothing happens to the baby almost 100% of the time. And so you have to ask yourself, we as adults have over 100 trillion bacteria that line nose to lungs, mouth to anus, skin, and reproductive system in women. So, wow, that's a hell of a lot of bacteria that then get into our bloodstream when we brush our teeth, we pick our nose, we eat our food, we rub our skin, we have sexual relations, we wipe our behinds. All those surfaces push bacteria into the bloodstream, and we still don't get sick. So the mere exposure doesn't kill us. And then the baby coming into the world should kill the baby if germs cause disease. And exposure to germs was sufficient to make the baby die. But then the last piece of that is we are never not exposed to germs.
Yeah.
There is never not a moment in our life where we aren't breathing in, swallowing, or touching germs. Because we are the pieces of dill in the large vat of split pea soup, which are the bacteria. And that's the thing. Like, we think we walk around in a bubble. Like, we think that the only time you're exposed to a germ is if someone is sick, and that otherwise there are no germs around us. And I love the term, there's a germ going around. Well, there's never not a germ going around. And so that's why I said that the idea that germs cause disease is incomplete, because on its face value, it doesn't. And I'll leave it at that, because unless you really want to dive.
No, I mean, that pretty much, I go back to like January 2020, December 21, and all the world's kind of rumbling, right? No, sorry, December 2019, and the world's like kind of rumbling, right? And I'm just like, come on. I didn't think it was going to go as crazy as it did, as like media crazy as it did. And then when it started to, I really just told our community, I just said, just remember what we taught you, like, and I think I appreciate you going through that just now, because that's foundationally what I've taught my patients, the principles of epigenetics, understanding terrain theory, and understanding the concept of that genes don't cause, or germs don't cause disease, that disease actually causes germs, right? Germs are more virulent, or whatever you want to call them and describe them, if your system has been in a state of disease and dysfunction for a long period of time and it's compromised, and it's like, people understand that logic, but if they only had the ability to continually hear that before, right, en masse, if they didn't continually like delete you and all the things that you put out there, then I think the level playing field would obligate people to actually be able to be exposed to real whole truths. Like I said, I agree with you when you say that it's incomplete, because the germ is a fraction of the terrain, right? If we think about the grandeur of the terrain, like, all of it matters, all of it plays into.
I'm gonna challenge something you said.
Yeah.
I'm not challenging you. I'm just challenging what you said. Although maybe I am challenging
That's
you.
okay.
We have to step back, and when the literature reports that the body has over 100 trillion bacteria. Now, again, we're not talking about viruses. That's a whole separate subject, as you know. But when the literature reports that the body has over 100 trillion bacteria, we establish where they are and we establish how they got there. The next most important question is, why are they there? And so most of us walk around believing that it's an us, them. That's what's taught, right?
Yep.
I mean, going back to the 1970s, the war on China, war on drugs, war on terror, war on germs.
The war on hate today.
Right. So it's always a war. And so I step back and I say, wait a second, we have 100 trillion or more bacteria, and they get into our bloodstream and our lymph system when we brush our teeth, pick our nose, wipe our behinds, rub our skin, have sexual intercourse, and nothing happens to us?
Wow.
So there's got to be another aha moment here. And, when I first started teaching this, I don't know how many years ago, over a decade ago, and I would say to parents, why, when babies are born, when they're not filled with 100 trillion bacteria yet, why don't they die when they're exposed to these microorganisms? And there's this blank look, like, really? They're exposed for the first time when they're born? You mean in utero they're not exposed? No, they're not. So why don't they die? And the reasons I came up with was, one, they're not overloaded. Two, their immune systems are strong for day-old babies. And number three, which I think is the most important one, is their immune systems have been here before, because they're getting the genetic history from their parents and their ancestors. So the nose and the mouth and the skin all come in contact, and then the baby starts breastfeeding and the bacteria go into the intestines. And in fact, the immune system lining all the surfaces of the body contains the history of having been here before. So these microorganisms, while they're new in context to the baby, are not new in context to the memory in the immune system. And so the immune systems actually see these microorganisms and go, okay, check, check, check. Hi, good to be here. Thanks. All right. So there's a knowing. That's what I find so fascinating. Talk about vitalism, right? Talk about this divine force of how this all works. I mean, think about it. When you go into a stable and you see a horse giving birth, I mean, it's in the mud. It's in the dirt. It's in the hay. It's filthy. And that foal comes out and stands up, having lied right in all the dirt, stands up and is fine, right? So there's something magical about the dynamic relationship between the human and the exposure to these microorganisms. And this dynamic is one of symbiosis. And this isn't taught, even though it's real science and it's right there.
Yeah.
And so then you ask, why are they there? And one of the most important reasons that microorganisms basically consume us, because there are trillions more of them than there are cells in the body, is because they're actually there to keep us healthy. They're actually there to make sure that the immune system doesn't get exposed to materials that are not good for us.
Are you challenging the statement disease cause germs?
Yes.
So by cause,
go ahead.
Good. By cause, I don't mean that it's a bad thing. I mean that they become more present because the germs are actually there. Like I love what you're saying. Germs are an inherent part of it, and whether it's H. pylori or it's any other bug, right? Like they're there to assist that potential stressed system, right?
Right.
I think
that's
you're
why I'm
it.
challenging it. I'm challenging it because I want us to use a different vocabulary.
I love it. I love
right?
it.
Because remember, germs cause disease.
Mm-hmm.
And I don't want to use cause, right? Because the germs that are on our body are there to keep us healthy and to make us stay in symbiosis with the environment.
I love it.
And to alarm us when we're not in symbiosis with the environment. And most importantly, they're there to clean out the junk that we have taken in and manufactured as a result of our body's natural functions. And so when you smell at the end of the day, that's your bacteria on your skin extracting your wastes. And when you exhale, a lot of the gas that's coming out is actually from the interaction of the microorganisms in your airway that are interacting with the wastes that are then giving off the gas, because you're also giving off liquid and particles when you exhale. It's not just gas. And when you have a bowel movement, the microorganisms lining the colon and the rectum are interacting with the body to get rid of the wastes. And when you bring wastes from the body towards the intestinal lining, it's the microorganisms that are extracting the wastes and helping the body get rid of the waste. When your tonsils are functioning ordinarily without symptoms, the microorganisms on the tonsils are extracting the wastes that are in your body. And so when you get quote unquote sick, those microorganisms aren't the cause. They're actually the solution. And so they overgrow on the skin. They overgrow in the airway. They overgrow in the sinuses. They overgrow in the tonsils to help your body extract the excess wastes that you've accumulated because you went stress happy and went past threshold. So the onset of overgrowth of microorganisms is actually the continuation of what the body was doing before you had symptoms in the first place. And so that's why I wanted to be careful and with the vocabulary, because your body's attempt to get well, your body's attempt to heal through the onset of symptoms includes the microorganism's role to augment its activity and its growth to help you extract the wastes, along with the mucus, along with the rash, along with the diarrhea, along with the vomiting, along with the mucus through your nose, along with the cough, and along with your swollen tonsils. And so we are treating all of these symptoms as if they're infections, right? Because the germs couldn't possibly be there beforehand. Now, all of a sudden, you're sick and the germs pop up. And of course, then you always get that question, well, how is it that everybody gets those symptoms? Well, because we're in a dynamic field.
Yep.
And we're all in an electrical field, and we're in an energetic field, and we synchronize as well as the microorganisms in our body that synchronize. So physical activity in one person can synchronize with someone else because you're aligned, you're entrained, you are rhythmic with each other. So these dynamic processes are not causal. And that's why I said, I'm going to challenge the disease causes germs, because this whole, I want to stop the usage of germs as causing or anything involved in causing symptoms. They're actually involved in solving, not causing.
I love it. I love it. It's crazy. All those things that you said, right? Whether it's something coming from the throat, or it's something coming from the digestive system, or if it's something even like a mental stress thing, the bioresonance field that, as you talked about previously, like a baby latching to a mom's breast, there's chemoreceptors, there's baroreceptors, there's sensory receptors in the nose, there's all sorts of receptors of an interplay of a nervous system and a bioresonance field that essentially says to mom, hey, this is what's in the ecosystem, this is what's in baby at this moment. Actually, let's program your system to actually generate the perfectly right food for that baby real time in that moment. And I know you've seen this over the decades you've been in practice. You see those, baby has a fever overnight, you see breast milk pumped the night before and breast milk pumped that morning. They're vastly different. And I think I appreciate you correcting me on that lexicon, because language is almost everything, right? And we can get too linear, and we can get too sterile, and we can get too conventional in the way that we communicate. Sometimes it helps people, but sometimes it also keeps us stuck in that paradigm. And I appreciate that, because it really needs to get into this more symbiosis type, solution focused conversation if we're going to actually get anywhere. So I appreciate you sharing. It's awesome.
Yeah, thank you for the opportunity to share that.
Oh, that's weird, right? I should just cancel you, Larry. What are you, a doctor?
Oh, I just
play. It's like the crazy things that we have going on today.
No, but this idea that germs cause disease is the root of the mythology of Western medicine. And once we are able to really practice Western medicine, we'll realize that pharmaceutical medicine is almost never needed.
So so some people might be, make the distinction between Western medicine and pharmaceutical medicine.
Well, right now, they're synonymous.
Yeah.
Right now,
but through your lens,
I'm an old fart in the whole framework of all of this. I trained in the Dark Ages. There are very few physicians who would remember the material that I was trained and the experiences that I had back in the 1980s. Think about it. 1983 is the year I entered medical school. Wow, man. That's 40 years ago. Think about it. 1943 to 1983 is no different than 1983 to 2023. That's remarkable in some ways. So, we have forgotten so much of our initial principles in Western medicine. And so Western medicine is a great science and has an amazing art to it, to its practice. We just don't do it anymore.
Wow.
I do it, and I've been doing it for over 20 years in practice. And I know that Western medicine, we don't have to call it holistic medicine anymore. Western medicine is a real practice. There's real physiology, there's real biochemistry, there's real immunology, real neurology, real gastroenterology, real cardiology, real nephrology.
Mm-hmm.
That stuff is no longer practiced because Western practitioners go right to the pharmaceutical.
Mm-hmm.
Right? You no longer even do. I mean, doctors are no longer, if there are doctors doing it, because now we're going to have robots doing it and computer programs doing it. But if a patient has a headache, it's irrelevant what caused it. We're going to do a CAT scan, an MRI, maybe another test, another test, another test, and we're going to go down the protocol of what treatments you are going to get based on the results of the test, or forget the results of the test based on your symptom presentation. And that's not Western medicine anymore. That's something else. I don't know what it is, but it's not Western medicine.
That's wild. It's crazy. I can't remember which documentary leading up to, maybe leading into Vaxxed. It was like, I don't know if it was Bot. It was one of the ones that I think Patrick Gentempo was a part of. And there was a medical doctor that was interviewed, and he basically said almost the same thing that I thought was one of the more profound things, but I'm not a medical doctor, and so I didn't really understand it fully, and I'm understanding it more now, is that the art of medicine is gone, right? The art of actually practicing Western medicine, like you're saying, because Western medicine and pharmaceutical medicine have become one, that they can AI it, right? They can outsource that to robots, and they can, because even in chiropractic school, even our diagnostic books, it was all if then, right? It was all algorithmic. It was all linear. All you had to do is memorize it to pass boards. But when you go into practice, like, you're sitting there with a real human being, and you really, really, really want to hear and listen and care for, like you're saying, like, see, hear, and care for these moms and dads in the practice. You can't dehumanize that child into an algorithm, and it's a gnarly experience, because I appreciate you sharing maybe more context to that, because is it actually just like follow the money? Is it actually also medical legal? Like, what are the forces that create that? I'm curious about it, because I would say, I mean, just going through what we went through with my son, right? I don't even know if I ever shared this with you, Larry, but my son, we figured out by 4 months old that his eyes were it was either eyesight or something. I wasn't sure if he was blind. I got my ophthalmoscope out, sent him to 5 other docs. The optometrist told me that he definitely could see, but wasn't fixating. Anyway, it's been a long journey. But he has at the time he had minus 11.5 myopia. And they're just like, how do you figure that out by 4 months old, But we took him to the medical ophthalmologist, and it was this crazy experience, right? Because it was just like, the tech was awesome, the nurses were awesome, and then the ophthalmologist, like, honestly, of all the people that gave my son an eye exam, gave the worst exam, right? Of all the ones that actually did give my son an exam. But in the process of going into further information, it was this complete loss of tone, this complete, like, it was almost like I felt like I was on, like, Grey's Anatomy, where it was just solemn, closed posture, very, very sorrowful. Like, we're going to have to do a brain MRI. We're going to have to put him under and do, like, a real, like, retinal exam. And I was like, no. In my mind, I'm pissed. But secondarily, we denied it. My wife was crushed. That's a whole other story, that if you want more of that, you can go to my solo cast for the listeners. But I started, because this was a friend of a friend, I started to get these email chains. And the way they were talking about my son is like, he's going to be a patient for life. He's going to be disabled for life. It was all this kind of like dark stuff about the prognosis of my son. And I started to sit back and I was like, I asked one of my physician friends, she's like, well, she's legally bound to say those types of things. She's legally bound to give the worst type of prognosis, essentially, because if she gives you too much hope, you could come back and sue her for different reasons. So I'm curious if the loss of the art, is it just capture by corporatocracies, by industry? Is it pediatricians? Like that's what reimburse, like that's what insurance companies are reimbursing this particular treatment, this particular drug for this particular condition, right? So you lose the art of practicing medicine because you don't get paid for it, right? Or is it also this kind of legal aspect that just is this veil, right? It's this veil over a doctor's maybe own conscience to keep that relationship human. I don't know. Maybe it's too much.
So I can't speak for all doctors, and I can't speak for why the ophthalmologist felt the need to go there. What I can say, just in my observation, is that the human has been taken out of the medical doctor education.
Yeah.
And the replacement is just good soldiers. And that's not across the board. Obviously, there are still, people who can withstand the system of just raping you of your humanity. But there are few and far between. And, I would say that just the general practice of medicine is not run by physicians anymore. It's run by the insurance companies, and it's run by those who own the practices, because doctors are no longer independent. So you literally don't have humans, you have soldiers who are having to follow whatever protocols, algorithms, and directions that they need to follow. And there are a certain number of patients they need to see per day, and they need to get certain product out of each patient, right? So they need to do certain number of tests, they need to give certain number of drugs, they need to give certain injections to reach their quotas.
Wow.
And so where's the medicine? Where's the art? But I would say, where's the science? Because if you're having to meet the goals of a corporatocracy that's sitting up somewhere deciding what your practice needs to look like, then you're not practicing medicine at all. You're just being a good robot and a good soldier. And I remember when the insurance companies really started to take over in the 1990s. And I was running a pediatric acute care unit. And I would have kids in the ICU who, based on the insurance algorithms on their diagnosis, they should no longer need to be in the intensive care unit. And I would get these calls from the insurance companies saying, well, Dr. Palevsky, we cannot cover the child's stay in the ICU anymore because the diagnosis only warrants a 3-day stay.
Wow, man.
And I'll say, oh, okay, but I'm letting you know that the patient has this condition and these symptoms, and this is what's going on now. And that requires more intimate nursing care. And I don't want to subject this child to being on the floor where the care level is different. I'm not saying worse, it's just on the floor. It's a different level of care. Oh, but Dr. Palevsky, I'm not going to be able to approve this. And I would say the following. I'd say, what is your name? I get the name. I mean, I was in my 30s.
Yeah.
So I'm 35, 36 doing this. And I would say, what is your name? And I'd say, okay, so I just want to let you know that this is what I'm going to do. I'm going to write your name in the chart and say that you have decided, without a medical degree and without examining the patient yourself, that this patient is well enough to be released from the ICU and to receive regular nursing care on the floor against the doctor's advice, who is sitting with the patient and experiencing these problems at present. Wow. Okay, Dr. Palevsky, I'll get back to you. And of course, they would always approve it. But this is what I had to do in the mid to late 1990s, because some idiot was sitting on a phone in an insurance company that was following an algorithm that said a child with appendicitis who ends up in the ICU should only have 2 days of coverage because the disease shouldn't need more than 2 days of coverage. Now, take that example and multiply that on steroids. That's what we're dealing with in 2023. Okay, and this is 27 years ago.
27 years ago, that's kind of interesting, right? Because I would say we call it in chiropractic. I don't know if you call it in medicine also. They call it the Mercedes 80s, right? Because it's when everybody was just reimbursements were so high, and chiropractors made a ton of money because we were just implemented into these systems, right? Which is a good thing, right? To have more access to patients. And in the end, you don't realize that you're essentially selling your soul because there's a third party, which is literally a third party, not a figurative third party. It's a literal third party between you and your patient, that they can not only just seize your records, but be intimately involved in the entire care of your patients. And so you actually went straight into it, Larry, because that's the second question that I get, right? Even in the freedom oriented community, they're just like, they're looking for a conventional pediatrician because they think they need one, right? It's an installed belief system, which if they're pediatricians like you, or the ones that you say subscribe to that original art of Western medicine, I would say everybody could use that as somebody in your wheelhouse that could help the optimal potential of your family.
Right.
The number 2 question is, do you take my insurance? And we've taken, maybe in my own private practice, I started it in November 2013. February, it was a year later. I got a check in November 2014 for care I gave in February. And I was like, this is terrible. It was just the bureaucracy and the paperwork where I was just like, that is so weird. And then I start to study it more, and I start to realize that once you sign your name on that dotted line, or whatever that system or that company is, it's almost like they own you to a certain degree, because they're always going to be embedded into the doctor-patient relationship, which is,
Right.
Arguably one of the most sacred ones in any society,
Well, there is no doctor-patient relationship.
Thank you for that.
There is no. It's you and your insurance company.
Yes.
Your doctor is sort of on the side.
Yeah.
You're really working with your insurance company. And I find that fascinating that people are okay with that. It's sort of like, the whole population gets flooded with mud, and initially it's uncomfortable, and you're wiping it off, and you're getting it away from your face, and then all of a sudden you just get comfortable with it. Over 20 years ago, I decided that I would never accept an insurance ever again. And I said that I would never allow another entity to decide what my value was and how much time I could spend with a patient, how much money I would be reimbursed for my time and my care and my expertise. And I would never allow another body to tell me how I needed to treat a certain condition, because then I might as well not be a medical doctor. You know, because I'd have to stand there and say, well, let me get approval, or let me check with the insurance company, or let me see if this is covered. Like, get the, you know what, out of here. I mean, you did not make it in my medical school. You did not teach me. You don't practice medicine. So I know how to keep costs down, because I don't do a lot of tests because I'm a clinician. Right? How many times would you go to examine a patient and say, oh, no, I can't do this yet. I have to do this test, this test, this test, and this test. No, actually, you were trained to touch, to listen, to feel, to examine, and then know what to do. You wouldn't need the tests because you were trained to do a history and a physical. And that's what I was trained to do. And I was trained that 95% of my diagnoses should be made by just taking a good history. And so that's what I do. I take a really good history, and then my exam just supports what I already suspect.
I love that.
That's not done anymore. Because the insurance company says, chief complaint X, go right to these tests, and then based on these tests, do these interventions. Well, that's not medicine. That's not even cookbook medicine. That's crap. That's just crap. And people are taking it. People are accepting it. And I don't get it, because I sit with patients, I listen, and I know what's going on within a couple of seconds of listening. And then I just keep asking and asking and asking, because, you know, medicine is about the story, you know. Medicine is about listening to the story and understanding the story, and coming up with an understanding of what is going on with the patient so that you can help them.
I think it's amazing what you shared earlier about the fact that you could be on the phone with some sort of third party, and you can say, hey, what's your name? And you can say, hey, by the way, I'm just going to put these in the medical records to say that you, without a medical degree, are denying, you know, what this doctor is saying is necessary, like medically necessary in this moment. And then, you know, the hang up and then call back. Oh, by the way, we figured it out, right? Like, it's like, imagine, right, if we didn't have a system that was already built to dehumanize the entire process, right, to rob humans of their own humanity. And then how many doctors wouldn't do that, wouldn't have either the idea to think of, by the way, I'm just going to do this, seems like a real New Yorker thing to do, right? But secondarily, to have the balls to do it, right? The balls or the ovaries to actually stand up for their patient in that moment, because you're in the ICU and it's literally lives are on the line. And what does it? What actually does it, which is maybe full circle to many of the conversations you and I have, is it comes back to who's going to be freaking liable, right? Who's actually going to be held accountable? Who can put their head down at night and actually lay their soul to rest at night, knowing that the mythological, like symbolic, but actually very real blood is on their hands or not. And it's crazy, man. I really appreciate you sharing that, because that will happen in multitude of settings. But the fact that it happens in a clinical setting, like you've been, you know, earlier on in practice, is crazy to me. You know, that
again, I'm not going to let some schmo who's just doing his or her job because some higher ups have decided through some algorithm and some charts that, look at, costs and benefits and risks and says, no, this is only supposed to be this. I mean, that's already dehumanizing.
But how many doctors do? Right?
Well, I don't know, but I know that it's gotten worse.
Yeah.
I know that
It's the same reason the whole ventilator thing, right? The whole diagnosis for COVID and ventilator thing, and then if it says it on the death certificate, like all the things that we saw, right? We saw with COVID were just amplified, right? They're amplified issues that are already in the system to some degree, right?
It's funny because a colleague of, not funny, a colleague of mine who volunteered in New York City emergency rooms during the 2020 fiasco. And he was ventilating patients who came in with COVID symptoms. And I said to him, why are you doing that? I said, you know that putting them on a ventilator is actually not the right treatment. They're hypoxic not because of a pulmonary problem.
Wow.
They're hypoxic because of a blood disorder or some kind of poisoning of the blood, some VQ mismatch, some kind of disassociation of red blood cells and oxygen. I said, the primary problem is not the lungs. Why are you putting them on the ventilator? And he gave me the answer that I didn't expect, but I expected. I have to, Larry. That's the protocol.
That's the standard of care.
And I said, well, but wait a second. You're a clinician. You're a clinician. Where's the medical doctor who's figuring out the patient's symptoms and coming up with a differential and trying to figure out? He's like, no, Larry, that's the protocol. I said, but how could you go against what you know? That's the protocol. It's like, the robot, that's the protocol. And Stanton, I just thought, wow. I mean, I haven't been in a hospital setting since 2020, 2000. And I bowed, I put my head down and I just said, wow, there's no more clinical medicine. No more.
How long do you think it takes to it completely implodes, or do you think it will?
Well, what do you call it now?
No, I mean, I would say it has already imploded in terms of its effectiveness to serve humanity. I'm saying where people just stop, right? Where people realize that that's not the way to go, right? Where we start to see, like, it's crazy. Like, we open a new hospital, and before that hospital opens, it's packed. Like the rooms are full, right? It's like the demand, because the infrastructure of the belief system that's where we go for our healthcare, I believe is still alive and well. I'm just curious if that.
I'm not sure that it's going to be a moment. Because, by asking you the question, how long before it implodes, it suggests that there will be a moment when it just implodes. I think it's a slow burn.
Yeah.
And, the more people decide, crowding that hospital is not in the best interest of their health, the more it implodes. And that's happening.
I think that
I have increased numbers of patients who have fully vaccinated their kids. And then because of COVID, they've said, oh no, not only do I not trust the COVID shot, but I've taken it to new levels, and I suspect the whole schedule. And, the American Academy of Pediatrics now is going full throttle to bring back these patients and teaching medical doctors how to use the right language to reestablish the trust. And my thinking is, the horse has left the barn. Like you are watching the slow death of your crimes against humanity, because the people are waking up. And that's, how long that takes, I don't know. I'm not so sure that we're going to have a whole lot of people come to that realization. I feel that there'll be enough for the shift to happen, because I think there are people who are going to be perfectly happy staying right where they are, putting as many drugs, as many tests, as many procedures, as many injections into their body, while they eat contraceptive infused, hormone infused, toxin infused foods that they are getting at the restaurants. Those people are not going to go away. And that system is not going to go away. I think what really is going to happen is there's just going to be a growth of systems that say, you know what, I'm not interested in what you're selling. I'm just not interested. And so all of that system is going to have to downsize. I don't think it'll go away. I mean, it's creating its own death as it's been structured, but it'll survive, because there are always going to be people who want it. But, looking into my crystal ball, which I'm joking, it just feels like there'll be enough of a movement that says, hey, you've been serving crappy burgers for long enough, and I want the good meat. And it ain't going to be the beyond stuff, and it ain't going to be the impossible stuff. It's going to be real stuff. And
I love it.
I don't want what you're selling anymore. And that's really what I think the shift is going to come.
Doc, as we close, what would you say is one big action step our parents who are listeners could take to essentially manifest and create the theme that we're talking about? How would you love to move our?
So, number one, remember you are the consumer. You are the consumer. And going into a pediatrician's office, if you're going in a subservient, obedient, worship mentality, you're not going to have a relationship.
I love this. Yeah.
So go in as a consumer who's saying, I need this, I want this, I'm interested in this. Can you offer it to me? I don't want this, I don't want this, I don't want this. I want this, I want this, and I want this. And stop asking for that person to be the person that you dream of, but who that physician can't be. And so that will stop the abuse pattern. Because I literally look at families and I say, okay, so you're afraid of conventional medicine, you're afraid of going to hospitals, you're afraid of going to doctors, you're afraid of going to clinics. And then when your child gets sick, all of a sudden you jump to what they're going to give you. I mean, and I usually use the example. So that's like a vegan going into a butcher and saying, please, you must have vegan food here for me. And so stop going into the butcher.
I love it.
Asking for vegan food because somehow that's the only way for you to get fed. And that's a continuation of an abuse pattern. Is I'm afraid I need to go to the big bad wolf and hope that the big bad wolf is going to treat me differently, give me something different, and abide by my wishes.
Yeah.
And so we have an education to do, which is to teach parents that that the answers are elsewhere. that there are resources, that children need to be sick in order for them to get well, that that there are chiropractors, there are osteopaths, there are craniosacral therapists, there are acupuncturists, there are Ayurvedic specialists, there's homeopathy, there's herbalists, there are some physicians who can actually help your child through those situations. So you're getting your vegan food where they welcome vegan foods.
It's beautiful. It's beautiful. Except we don't have vegans on our podcast. No, I'm just kidding, man. I'm joking. We don't have the Impossible. No, I'm paid for by Impossible Burger. No, I'm just kidding, man. Larry, that's awesome.
Another poison and another cancer causing.
Lab-derived meat made from the cells of meat is not meat. It's plant-based and healthy. Oh yeah,
I walk into certain stores and I see that stuff in the freezer sections, and I say to myself, people really buy this.
They do.
People really buy this.
Doc, okay. Doc, I genuinely love and appreciate you. I think maybe we need to maybe we got to create something or something, for the population, so that they can maybe decipher this and they can be educated, because I didn't know that's what we were going to talk about. But I also just know that if you're seeing that in your practice and I'm seeing that, in my practice to some degree, it's like this continual magnetism towards this abuse pattern because of an installed belief system. And sometimes it's just as simple as you go into the damn butcher and you eat plants. You don't get plants at a butcher. Remember that. It's that simple, that maybe there's an en masse education process that needs to happen. And I think there's no one better to do that than you.
Oh, you're very
as
kind.
If you didn't have a laundry list of things that you know.
Oh, actually, that is my dream.
Okay.
My dream is mass education.
Okay. Well, maybe we'll have to talk offline about some things that we could work on, because that is mine too.
Okay.
Dr. Palevsky, you are in my own awards system, and I would say the entire movement that I've been blessed to be a part of. You are the single most important pediatrician that I know, and I'm very grateful for you. I'm grateful for your heart. I'm grateful for your humanness. I'm grateful for your rationality. But also I'm grateful for your humor. It is so funny to just sit and I have to hit mute sometimes because I'm laughing so hard, and I don't want to be too unprofessional. But at the same time, I just know that this is, if there is an approved solution at West Point, they called it an approved solution. If there is an approved solution for what, real doctoring looks like for the future, especially for our kids, I appreciate you for embodying that. And
thank you, Stanton. I appreciate that, and
can't wait till our paths cross again.
Growing up in Queens, New York, I had to have a sense of humor, and Oscar Wilde often said, "If you want to tell somebody the truth, you better use humor. Otherwise, they'll kill you."
Oh, there's no better way to end it. Thank you so much, man. I genuinely appreciate you.
Thank you, man.
We appreciate you joining us for this episode of the Future Generations podcast. Remember to rate, review, and subscribe on iTunes and Spotify. For more resources based on today's episode, as well as more ways to inspire a brighter future for you and your family, visit us at thefuturegen.com. That's all available exclusively on thefuturegen.com.